Hello, I'm Harold Pollack. You know, the most popular aspects of health reform are the provisions that protect people against insurance company discrimination. Governor Romney has pledged to overturn health reform, and he's come under a lot of pressure to explain how he would protect people from some of the same practices, particularly people who have pre-existing health conditions. This week, he announced that he would support a sort of open enrollment period during which people could sign up for insurance, and as long as they stayed continuously insured, they would enjoy many protections against having their premiums increased or being denied coverage because they had an illness. And this would be sort of a one-time amnesty for people who right now are uninsured. Now, this is a step forward, but it really is not going to do the job. And let me just explain to you a couple of reasons why. One of the most basic reasons why we know it's not enough is much of what Governor Romney is talking about are protections that actually are already included under current law under something called the 1996 Health Insurance Portability and Accountability Act, HIPAA. So those of us that work for reasonable size employers already enjoy just about all the protections that Governor Romney was talking about. So we still have 50 million uninsured people. Clearly what he's talking about is not really going to be enough to do the job. Now let me put this in a little bit more specific context. So let's consider there's about 4 million people right now who are uninsured and who've been diagnosed with serious health conditions. And by serious health conditions, I mean things like cancer, they've had a heart attack or a stroke, emphysema, diabetes, things like that. Expensive conditions that would make it really hard for you right now to buy health insurance in the individual or small group market. Conditions that that just are both expensive and that which really require a lot of care. Now, how does Governor Romney's proposal really make sure that those people are taken care of? Now, the first thing you might think about is, why are these 4 million people uninsured in the first place? And of course, the basic answer is, for many of them, is that health insurance is expensive. It's particularly expensive for them because they have these conditions. But even if they didn't have these conditions, it would still be expensive, as many of these people have modest incomes. They were actually uninsured before they had their pre-existing condition, and they couldn't afford the monthly premiums. Maybe they were between jobs. Maybe they took a chance on being healthy and that didn't work out. Or they just have a pretty low income. Now, the Affordable Care Act, through Medicaid and health insurance exchanges, make sure that everyone has access to affordable health insurance. And the best estimates are that repealing the Affordable Care Act, as Governor Romney proposes, would lead to about 30 million people being uninsured who otherwise would have been covered. And so a lot of those people, if they develop a health problem, are going to be exactly in the same situation as those 4 million people I was just talking about. Also, one has to make sure that your health insurance actually works if you get sick. And it may be that the Romney plan has something valuable to offer here, but they just have not offered the details about what they have in mind. Give you one example. The Affordable Care Act outlaws annual and lifetime caps that a lot of insurance companies had imposed when people had serious illnesses. So if you have an infant who goes into the neonatal intensive care unit, you can run up hundreds of thousands of dollars of bills. And then one day you can get a letter from your health insurance company, or you could before health reform was passed, that said, you've hit your limit and we're not going to pay anymore. And what do these families do? It was a huge problem, and it was a problem that was solved by the Affordable Care Act. I'll give you another example. Near where I live, in the south side of Chicago, a high school football star was rendered quadriplegic on the gridiron. He required a lot of nursing care, and he hit his lifetime cap. After that, his mother did her very best to take care of him, but she really couldn't do everything that needed to be done. He eventually died under quite tragic circumstances. I don't have no reason to think the lifetime cap had anything to do with that, but I do know that his mother was left with a pile of unpayable medical bills. And she's a person of very modest incomes, and it's inexcusable. Another thing that's in health reform, which requires greater discussion, is something called the essential health benefit. And this really means that if you get sick, that your insurance policy covers a reasonable standard of care. So it doesn't cover everything. It can't be gold-plated, otherwise it would not be affordable. But if you get cancer, the basic chemotherapies have to be covered. The standards of care have to be covered. If you have MS, the standard MS medications have to be covered. And that's something the Affordable Care Act says, basically, insurance has to match what the typical small employer would offer if they offered a reasonable policy. And it's a good compromise. And before health reform, many people had insurance. Many people still have insurance. That when they get really sick, they discover, hey, my health insurance just doesn't work. Now, it may be that what the Romney team has in mind can deal with some of these specific issues, but they certainly have not shown it in any of their plans, and they certainly have not shown that they're going to take the steps that are needed to really make health insurance affordable and effective for everyone in America. So they've made a step forward, but it's still nowhere near enough. Thank you.